IVF, just from a philosophical standpoint, is not a cure of any disease. Women are going to address infertility, sure, but the IVF specialist simply says, we have a workaround called IVF. We're going to hijack and basically take control of your hormone system, of your ovulation for the next several months, and put you through a very strenuous set of protocols to make your ovaries and body do what they were never really designed to do, which is hyperstimulate and develop 10, 15, 20 eggs to make multiple embryos. So just the process is so physically taxing and demanding, not to mention psychologically and financially burdensome for couples and patients who go through the IVF process. And then at the end of it, potentially they would have spent tens of thousands of dollars to complete several rounds of IVF with not even a single pregnancy to show for it. So they walk away with quite literally nothing. In addition, not a pregnancy, but they haven't gotten a treatment or diagnosis or any underlying evaluation of the underlying causes of the issues that are causing their infertility. So they're left no healthier. So that, from a medical reasoning perspective, we would say, well, that's simply just not the way medicine, in my mind, should work. That we are having a patient come to us for a particular condition. We don't care enough to identify or treat the underlying reasons for that condition called infertility, which has a myriad of underlying causes. And instead, we ask the patient to just bear with us while we put their body through something that it was never meant to do. So I think that's one major issue with IVF. Of course, the other issues that attend IVF are there's a much higher rate of preterm delivery. We care a lot about preterm births because it comes with higher childhood issues and infant mortality. We also know that there's a higher rate of having congenital defects like cleft lip, cleft palate, neural tube defects. Even a singleton to a singleton pregnancy, a one-to-one, it's not just because IVF oftentimes will result in a twin pregnancy or sometimes even a triplet or quadruplet pregnancy, but even one-to-one, those children born of IVF are not as healthy as those born from a natural conception. The women who are going through the IVF process are at risk for having what's called ovarian hyperstimulation syndrome, which can be a very severe and even life-threatening condition in cases. So it doesn't take long to start to walk down this path of understanding, once we know what IVF really means for the person who's going through it. Yes, I know that the couples have the goal, the sight set on the pregnancy ultimately, but it not only potentially endangers the patient that's going through it because it's so intense, but also leaves you with a much lower success rate.